السلام عليكم. في هذا الفيديو سنتعرف معا على أساسيات تحديد الكسور في صور الأشعة السينية، وسنوضح الأنماط الأكثر شيوعا للكسور وكيفية التمييز بينها، مع ذكر العلامات الرئيسية التي يجب معرفتها على صور الأشعة. شكرا.
Bone fractures on X-ray, the basics. Hello and welcome. Today we will take a closer look at one of the most important topics in radiology: how to identify bone fractures on X-rays. Whether you're a medical student or just starting your radiology journey, these basics will help you interpret images with more confidence. What is a fracture? A fracture is simply a break in the continuity of a bone. On an X-ray, bones appear white because they block most X-ray beams. The causes of bone fractures include trauma, accident or impact, osteoporosis, weak bone, overuse, stress fractures as running athlete. A fracture interrupts this white line and the break often appears as a dark gap or line. Depending on the severity, it may be very obvious or subtle and hard to spot. Types of fractures. There are different ways to classify fractures. 1. Complete versus incomplete. Complete fractures go all the way through the bone, while incomplete fractures, like greenstick fractures in children, only go part way. 2. Displaced versus non-displaced. In displaced fractures, bone pieces are not aligned. In non-displaced fractures, the bone maintains its normal position. 3. Pattern of the break. Transverse fractures are straight across. Oblique fractures are at an angle. And spiral fractures twist around the bone, often due to rotational force. Key signs on X-ray. When examining an X-ray, look for these signs. Fracture line. A dark, sharp line crossing the white bone, step-off or cortical disruption. The bone edge looks broken or shifted. Abnormal angulation. The bone is tilted compared to its normal alignment, widened joint space. If the fracture extends into the joint, the secondary signs include swelling of surrounding soft tissue or visible hematoma. Tips for beginners. To avoid missing fractures, always compare with the opposite limb if possible. Check the entire bone from joint to joint. Don't focus only on the area of pain. Use multiple views, at least 2 views to confirm. Be cautious with subtle fractures, especially in the wrist, ankle, and ribs. They can be easy to miss. Fracture detection is a core skill in radiology. With practice and a systematic approach, you'll get better at spotting both obvious and hidden injuries. Thank you for watching and keep learning.